Okay, so have you ever been working at the computer for hours? The air conditioning is on and your eyes just start to feel like sandpaper?
Yeah.
It's the worst. And it turns out that dry eye is way more complicated than I ever thought. Like, I just
Right.
thought my eyes were dry, end of story.
Yeah. Yeah.
But there's actually a lot more to it than that, right?
Absolutely, yeah. It's way more common than people realize, and there can be some pretty serious impacts from it, just in your day-to-day life.
So it's not just like a minor annoyance. It can actually like impact your life.
Absolutely.
Wow. Okay, well, I, for one, am ready to dive into this because I think I suffer from dry eye,
Mm-hmm.
and I had no idea how impactful it could be. So let's start with the basics. When we talk about dry eye, most people think of that, that scratchy feeling, but are there other symptoms that we should be aware of?
Yeah, absolutely. You hit it right on the head. Those are some of the classic signs, the scratchiness, dryness, irritation. But, a lot of those symptoms can actually be caused by different underlying issues. So it's not necessarily a one-size-fits-all diagnosis.
Wait, are you saying that there's different types of dry eye?
Yeah, there are three main types to be exact.
Okay, I had no idea. So what are these different types?
Well, the first type, and this one might resonate with you sitting in front of a computer right now, is called evaporative dry eye, or EDE. And this is where your tears are actually evaporating too quickly from the surface of your eye. And that's often linked to, things like reduced blinking, digital eye strain. We're staring at screens all day.
So all that screen time is really sucking the moisture out of my eyes. I knew it.
That's right.
Okay, so that's one type. What's another type of dry eye?
So, kind of on the opposite end of the spectrum from evaporative dry eye, we have aqueous deficient dry eye, or ADDE. And in this case, it's not so much that your tears are evaporating too quickly, but your eyes just aren't producing enough tears to begin with.
So two totally different problems with basically the same net result.
Mm-hmm.
Dry, irritated eyes.
Exactly.
That's our third type then.
The third type is kind of a combo platter of the two. It's called mixed dry eye, or MDE, and it's essentially a combination of both evaporative and aqueous deficient dry eye.
So the worst of both worlds.
Essentially.
Oh, joy. Okay, so this is already blowing my mind because I just thought dry eye was dry eye.
Right.
But you're saying that, like, depending on the type of dry eye you have, that could determine, like, the best course of treatment.
Precisely.
Okay, so what causes these different types? I mean, we talked about screen time,
Right.
but there's got to be more to it than that.
Oh,
Right?
there's definitely a lot more to it. Screen time is a big one, but it's not the whole story.
So give me the dirt. What else causes dry eye?
Well, one thing that we can all look forward to as we get older is, unfortunately, our eyes naturally start producing fewer tears as we age, especially past 65.
Ugh, so it's like a slow march to dry eye as we age.
In a lot of ways, yeah.
Great. Well, what else besides just getting old?
Another big one that people don't always think about are medications. Certain medications can actually have side effects that can reduce tear production.
Really? Ooh. Okay, so like what kind of medication? Because I take allergy medicine every day. Could that be drying out my eyes?
It's entirely possible. Antihistamines, which are often found in allergy medications, those are a common culprit when it comes to dry eye. But it's not just allergy meds. Certain heart medications, antidepressants, and even birth control pills can actually have an impact on tear production.
Wow, I had no idea. That is way more common than I realized. So
Okay.
what do you do then if you think your medication might be drying out your eyes? Do you just stop taking it?
No, don't stop taking your medications. That's definitely something you should talk to your doctor about before making any changes. But they can help figure out if that is a side effect and if there are any alternative medications or treatments for either the dry eye or the condition. But medications aren't the only thing. There are other underlying health conditions that can also play a role in dry eye.
Okay, so what kind of health conditions are we talking about here?
Things like diabetes, arthritis, even thyroid issues, those can all impact that delicate balance of your tear film and lead to dry eye symptoms.
Okay, so it's not just our eyes, it's like our whole body.
Exactly.
Wow, it's like this big conspiracy. So we've got age, medication, other conditions,
Yeah.
but, we live in this modern world. Does our modern lifestyle play a role in dry eye?
Absolutely. And you're right to point that out because it's a huge factor. We spend so much time staring at screens these days, computers, phones, tablets.
Guilty.
And when we're focused on those screens, we tend to blink a lot less than we normally would, which disrupts our tear film.
So not only are eyes drying out, but then we're also not blinking, so we're not getting that extra moisture.
Exactly. And it's even worse because screens also emit blue light, which can disrupt tear
Oh,
production.
that's right. Blue light. That's why people wear those like blue light blocking glasses.
Right, exactly. So that can be really helpful for some people.
Okay, so it's not just the screens themselves. It's also the fact that they're making us stare and not blink.
Right.
And then we're getting all that blue light in our eyes.
Yeah.
It's like a triple whammy. And you know what else? I feel like office air. When you're sitting in your office all day and the air conditioning is on, it's like,
Yes.
it's so dry.
Absolutely. The air, both heating and cooling, but that dry air, it just sucks the moisture out of your eyes.
It's the worst. And what about people who wear contact lenses?
Contact lenses can definitely be a factor as well. They sit right on the surface of your eye, and so they can interfere with that tear film and make dry eye even more uncomfortable.
Okay, so we've uncovered all of these causes,
Yeah.
and it's a lot to keep track of, right?
Mm-hmm.
So if someone is suffering from dry eye, how do they even figure out what's causing it? That's where seeing an eye doctor comes in, right? You can't just, like, diagnose yourself.
Exactly. Exactly. Dr. Google is not always your friend in these situations.
Yeah, definitely not. So let's say you go to the eye doctor and you say, hey, I think I have dry eye. What happens?
Well, they're going to ask you a lot of questions. They'll want to know about your symptoms. How long have you had them? How severe are they? What makes them better or worse? And then they'll probably ask about your medical history, what medications you're on, your lifestyle, all those things we've been talking about.
So they're really trying to, like, get the full picture.
Exactly.
Okay, but how do they actually know if your eyes are dry? Like, do they have a way to measure that?
They do. There are actually a lot of really cool tests now that eye doctors can use to objectively measure both the quantity and quality of your tears.
Okay, tell me more about these tear tests.
So one of the most common tests is called the tear breakup time test, or TBUT, and they basically put a little bit of dye in your eye, and that allows them to see your tear film, which is that thin layer of tears that coats your eye, and they measure how long it takes for that tear film to break down.
And so if your tears break down really quickly, that means you have dry eye?
Exactly. It means your eyes aren't staying lubricated enough, which can lead to those symptoms.
Fascinating. What else do they measure?
Another thing they might look at is the osmolarity of your tears, which is basically the concentration of salt.
Okay.
If your tear glands aren't working properly, the salt concentration in your tears can get too high, and that can also lead to dryness and irritation.
Wow, so they're really looking at, like, the chemical makeup of your tears. That's incredible. So once the eye doctor has, like, poked and prodded and figured out what's going on, what are the treatment options? What can you do about it?
Well, the good news is that there are a lot of different treatment options for dry eye. The bad news is that it really depends on, what's causing it and how severe it is.
Okay, so walk me through some of the options.
Well, I think it's helpful to think about treatment in two different categories. There's supportive management, which is all about kind of like relieving the symptoms, right now, making your eyes feel better. And then there's definitive treatment, which is more about addressing the underlying cause of the dry eye in the first place.
Gotcha. Okay, so let's start with the supportive management. Like, what can I do to, like, make my eyes feel better right this second?
Well, artificial tears are a big one. Pretty much everyone's heard of those. They can help lubricate the eyes and kind of replace some of that missing moisture.
Yeah, I buy artificial tears all the time at the drugstore, but they never seem to, like, last very long.
Yeah, and that's a common complaint. A lot of people find that artificial tears are just a temporary fix. But one thing that can help is to look for preservative-free artificial tears.
Mhm.
Those preservatives can actually irritate your eyes in the long run.
Oh, okay, so it's those preservatives, so look for preservative-free.
Yeah, and another thing that can really help are warm compresses.
Ooh, warm compress.
Yeah, just that warmth can help to stimulate the oil glands in your eyelids, which can improve the quality of your tear film.
It's like a little spa treatment for your eyes.
Exactly, exactly. And then there are even, believe it or not, blinking exercises you can do.
Blinking exercises, what are those?
It sounds funny, but when we're looking at screens, we don't blink as much. And those blinking exercises can help to kind of retrain your eyes to blink more naturally and spread that tear film around.
It's amazing to me that, like, blinking is something we have to think about.
I know, right?
It just shows how much, like, our modern lifestyle really is impacting our eyes. Okay, so those are all really great tips for supportive management, but you also mentioned definitive treatment. So what about that?
So definitive treatment is really about getting to the root cause of your dry eye. And so that might mean switching medications if that's a factor for you, or it might mean treating that underlying health condition like diabetes or thyroid issues.
So it's really about taking that holistic approach.
Exactly. And sometimes it might even mean a procedure like punctal plugs.
Bungle plugs, what are those?
So you know how you have those tiny little holes in the corners of your eyelids where your tears drain away?
Yeah.
Punctal plugs are these tiny little devices that your eye doctor can insert into those holes to basically block your tears from draining away so that your eyes stay lubricated for longer.
Oh, interesting. So they like dam up the tears.
Exactly.
Okay. Well, this is like so much information. I feel like we could talk about dry eye all day.
Oh, yeah.
But for the sake of our listeners who probably also have dry eyes and don't want to be listening to us talk about it forever, I think we should probably wrap things up.
Okay.
But this has been, honestly, so informative. I had no idea how complicated dry eye could be.
Yeah, and you're definitely not alone in that. A lot of people think it's just a minor annoyance, but it can really impact your life, and there's so much to know about how to treat it properly.
Absolutely. Well, thank you so much for joining us today and shedding some light on this dry topics.
Oh, it's been my pleasure.
And for our listeners, be sure to check out our show notes for more information about dry eye. We'll have links to all of the resources that we talked about today, as well as some additional reading material if you're feeling extra thirsty for knowledge. Until next time, stay curious.